If your future as a clinician will involve working with immunocompromised patients, whether as an MD, PA, nurse practitioner, nurse, whatever. Cryptococcus neoformans will be something you have to take into account as you're doing your, what do they refer to it as, differential diagnosis. Here's the, presented with meningitis, here's my top 5 causes that could be, for this patient. What we have found over the past 4 decades of treating AIDS patients. Remember, AIDS patients, just by their name, means they are no longer considered HIV positive. They have now progressed to the point that their T cell counts have dropped below a threshold that we would consider them to have an active immune response. Their immune response is now degraded to the point that they cannot fight off what should be non-pathogenic organisms. You look around you in the dorms, you look around you at home, everyone's healthy. Cryptococcus neoformans, this fungi, would not be a problem for any of them. Okay, this is only a pathogen to truly immunocompromised patients. The disease you will see in AIDS patients or other extremely immunocompromised patients is what is referred to as meningoencephalitis. The microbe is growing in the meninges. The meninges have literally broken down to the point that the microbe has now gained entry into the central nervous system, into the brain tissue. So you literally will have the fungi, Cryptococcus neoformans, growing in and on the surface of the brain. Symptoms you're going to see here: headache, stiff neck is where it starts, and then it will progress. Once the Cryptococcus gets into the brain, you're going to see extreme mental alterations, delusions, hallucinations. I have read that there have been some patients, they present as though they're having a stroke due to the presence of the bacteria or the fungi on the brain and the induced immune response doing direct brain damage. As it is, if you've ever been in an urban setting, you've been exposed. Okay? Turns out Cryptococcus neoformans likes birds, specifically bird poo. Pigeon poo is a great source for Cryptococcus neoformans. That's why I said if you've ever been in an urban setting, those damn rats with wings are spreading this everywhere in the city settings, in their feces. It's the high nitrogen environment, the high nitrogen content of bird droppings, of bird poo, that this fungus grows great on. So if you've ever been in the city, you've ever been on campus, and all those pigeons will be there, or other birds present, you've breathed in Cryptococcus neoformans. But the thing is, you are healthy. You have a healthy immune response, so you are able to take care of it before it ever was truly able to colonize. AIDS patients, not so much. Your textbook likes to say frequently fatal. Frequently fatal, nah, this is pretty much, once it has progressed beyond meningitis and you have encephalitis, invasion into the brain, it is fatal.